that is interesting to me. So I congratulate the organizers, not just for the beautiful event, but also for putting us to think about the CEAP classification to use it in early stages. It is true, we saw before, Prochaska study is telling us that there is a correlation between the CEAP clinical class and on the cardiovascular risk of potential mortality. But have a look at this nice slide that I like to use as the only slide of this talk. There is no overlap between the damage of the histology report on the vessel and the different clinical classes. So end of the story. We cannot really say C0-C1, but we can go back in history and look at the Edinburgh study. Look how interesting it is if you dissect as a surgeon these studies, because the conclusion of the Edinburgh study is that with a 13 years follow-up, having or not the reflux at the starting point was not going to change the end point of reaching to the most severe CEAP clinical classes. Food for thought then for the discussion. It's maybe time to stop even talking about the reflux time. There is a very interesting publication, 2,000 patients, showing us that actually C1, C3 had a longer reflux time than the other ones. And indeed, we did some investigations, as Ferdinando knows, about biomarkers inflammation, showing that there is not a direct correlation just with the reflux time. It's far more complex, but this is not the topic of this talk, but just again, for food for thoughts. Very interesting publication from Japan showing that it's a combination of velocity and time. So basically turbulence. So basically the nice talks we heard about the glycocalyx and all the biomechanical transduction that we have at the endothelium level. It's very complicated. It's not just a C0, C1. If you look, there is no real correlation according to the literature between what the physician reports, what the patients report, what the ultrasounds report. There is some correlation with the NCQ and DANES, not that much with the Venous Clinical Severity Score. It's a very difficult topic because indeed it is important, the C0, C1 and so on, because already at C0S, as you can see in this publication, in this nice picture, you have a functional capillary density decrease. You see that already at the C0S, you start having an evidence of the damage. But again, among friends, colleagues, I agree to disagree about the possibility of really stopping the evolution of chronic venous disease. I agree with Forrest Gump, who was saying that life is like a chocolate box and you never know what you're gonna get. Because indeed, there are so many different modifiable and not modifiable factors for which I think it's pretty soon to really say in an evidence-based way that we have the demonstration we can surely prevent the evolution. Of course, we have good products, we have good studies, but we really need the proper data collection. Also because I would have liked to ask Ferdinando also the importance of the lymphatic endothelium, where we have been very happy to identify the presence of the glycocalyx for the first time in human in a publication we put on Scientific Reports of Nature, so a very serious collaboration with international colleagues that is really telling us that the glycocalyx is a sort of antenna that is communicating with arteries, veins, but also lymphatics. For the new generations,